Hello, good afternoon, everybody. Today we will be discussing donor eggs, everything about choosing donor eggs with Saga, who is the representative today from Cryos International Sperm and Egg Bank. They have recently opened an egg bank for the EU, and so I'm delighted to be speaking with her today to find out more about it and to answer your questions all around egg donation. We've had some brilliant questions come through, which we will discuss live now. So ask anything, please feel free as we speak. Just connecting now. Hello, hi to those joining. Good afternoon. Hi, Saga.
Hi.
How are you?
Hi, nice to meet you, and thank you very much for inviting Cryos and myself to speak to you, and a big hello to all your viewers.
Absolutely. So donor eggs is a huge topic which many of our readers are looking into. Please could you start by telling us a little bit about you, because I believe you have 20 plus years of experience in the fertility field. So it'd be lovely to know more about you and a bit about Cryos as well.
Sure. So I've been an embryologist in the UK.
Yep.
Actually, for almost 26 years now.
Wow.
Without giving my age away. And I've worked in a number of IVF clinics in the UK, been very privileged to work with many colleagues that are very excellent professionals in this field. I've been with Cryos for over 3 years. I started the European Egg Bank project. Cryos opened its first egg bank 5 years ago in USA, Orlando. It was such a successful project that having been in a sperm bank for almost 34 years, starting from Denmark, we decided to embark on opening our first European egg bank. And we chose Cyprus, and it was a project that I've been working on for about 3 years since I joined.
Wow.
And
that launched last week.
Yes, it launched last week, and we are very proud and very privileged that for first time after Corona, we had so many colleagues, doctors, embryologists, nurses, donor coordinators who either joined us physically and flew over to Cyprus, or joined us online for our opening and the symposium. So we had a great opening ceremony, and then it followed by a great symposium of Cryos, which is our fourth international symposium. So yes, we embarked on opening this bank because there is a huge need for egg donation in Europe as well, and unfortunately there is a lack of donors in most of the countries, and we have seen that this treatment has been more and more in need for our patients. And therefore, we decided that obviously, as being a bank that with the expertise of cryopreservation and freezing, that we could provide the same excellent service we do for our sperm for the donor eggs as well.
Mm-hmm. So I have sperm donor conceived children, so I'm always delighted to talk about donor conception. Please could you start by telling our readers who donor eggs may be for and why?
Sure. So egg donation is basically for patients who either don't have their own eggs, or they have very poor quality eggs. So it could be women that are of older age, so above the age of 40, that may have, for various reasons, delayed motherhood and could not start having a family until they were in their 40s. And if that is the case, we will see that the quality and the quantity of eggs drop sharply after the age of 40, and therefore there may be a need for egg donation. We also have patients that have genetic disease. For various reasons, they either don't have ovary or they don't produce eggs. And if that's the case, again, they are the kind of patients that would need to receive egg donation treatment. We also have patients that have a number of failed IVF cycles that unfortunately the reasons may not be very clear, but the doctors sometimes tell them that it is possible that could be with regards to poor quality eggs or not enough eggs that they are getting through their IVF cycle. And again, we also have patients that may have gone through early menopause, unfortunately. We have women in their 20s or 30s that go through early menopause. And if that is the case, again, those are the kind of patients that need to have treatment with egg donation. And in any case, it would be any woman that cannot produce good quality or good number of eggs by themselves. And of course, we have the same-sex couples, so we have gay couples that would need to have egg donation and surrogacy in order to achieve their own family. So therefore, there is a number of reasons why egg donation would be needed. And it seems that with more infertility being on a rise generally, we've seen it in recent WHO, publications, that it is unfortunately on a rise. And this has also meant that egg donation need has gone up. And we must meet this demand from the patients and clinics. We have, in UK, for example, we know that we have long waiting lists because we don't have enough egg donors.
Yeah.
And many clinics may have waiting lists as long as 18 months to 2 years. Wow. And for that reason, there is a huge demand for egg donation treatment.
And so that's intended parents. What about the egg donors? How do you recruit them? What tests or screening do they need to go through before they can become an egg donor?
Yeah, definitely. Firstly, I would like to say a huge thank you to our heroes. Our heroes are the egg donors and the sperm donors that we have. They're the ones that give altruistically. The process of egg donation is a lengthy process. The women that come forward to donate their eggs, they have to have a commitment of at least 2 to 3 months of coming to the bank and going through very vigorous checks on the physical health, mental health, their family background. And they're usually women for Cryos. We usually take women around the age of 18 to 32. Because we want to make sure that we provide the highest quality eggs possible for our patients to give them the best chance possible, of course. And usually they are young ladies that are either studying in universities or they've done higher education and they've started working. Preferably, we would like to have women that have got their own children because that's proven fertility. But of course, that age range these days is getting harder and harder to find donors that have had their own children. But we do a lot of physical assessment on them and hormonal checks and of course sexually transmitted diseases check to make sure that they are healthy. We do genetic tests on them to make sure that the genetic background is healthy, that there is minimal risk of passing any kind of genetic disease to the offspring. And of course, we look at the health of their ovaries as well, because one thing is to get very good quality eggs, but also their health is important when they are going through this process.
Definitely. To that point, do you do any checks on mental health and well-being, that kind of thing?
Yes, 100%. They see an independent counsellor, and then the counsellor would send us a report and make sure that the donor, we need to make sure that the donor knows the implications of their donation. For example, what will happen in 18 years' time if they are non-anonymous donors or ID release donors, when the children that are born as a result of their donation want to contact them? Will they discuss this with their own family in the future, or the children, their own future children? So yes, we do these checks through an independent licensed counsellor. And we also make sure we evaluate their emotional, state, and we actually have a full report of that on our website for the patients that want to see when they choose a donor. So we provide quite a lot of information on our website with regards to the tests that we do for the donors that patients can have access to and they can immediately see it. So beside the family health check that we do, we go back to 2 to 3 generations to see if there is any issues with the family history, for example. Could there be cardiac issues or diabetes or cancer and so on? We look at the risk factors. Are they smokers, heavy smokers? Are they heavy drinkers? The risk factors and lifestyle. Blood type, the karyotyping. And as I said, extensive genetic tests as well. So yes, they get checked very thoroughly.
I saw something that a quote through Cryos, which I loved, which was some others save lives and some give lives, which I thought was just such a nice way of explaining
Yes,
why
yes,
donors do that. And I think that is one of the questions that we get a lot from our readers that I'd love you to answer. What's their motive behind becoming egg donors?
we have been doing some surveys with our donors, and also there is also, I'm sure there's a lot of information about this out there. Because obviously in Europe, the level of compensation they receive is relatively low, and because of that, most of the donors come through for altruistic reasons. Majority of them know someone in their family or friends who've been suffering from infertility, so they have seen it firsthand how this impacts, their loved ones, and many of them, of course, come through because they also get a very thorough health check regularly with us, and they like that aspect of it. And of course, there are some that compensation can be very helpful to their life. But majority of them are altruistic because of the low levels of compensation that they get paid in Europe. They are, we see them as heroes, so heroes that actually give the gift of life. And yes, if you've seen the campaign, we have doctors and firemen or women, policemen or women who, we call them saving life, and then we have our sperm and egg donors that they do this donation in order to be able to give the gift of life to families that like to have children and want to make their dreams come true.
Well, we're forever grateful for our sperm donor. I mean, he absolutely changed our lives. So I completely agree with that, sentiment for the campaign that you've run.
Yeah.
And then also when people are selecting a donor, tell us a little bit more about the process and non-ID release versus ID release, because I know that can be a big decision for people to make when they're in deep depths of infertility, for example.
Yeah. When patients want to select donors, it's very important that I think your viewers are mixed from UK, Europe, and US perhaps. Obviously, they need to be aware of the regulations in their own country. So, for example, if they are from UK, the regulations allow non-anonymous donation. So if they want to have anonymous donors, then they have no choice but to go abroad. The first choice is really for the family, for the intended parents to actually think, what is it, what sort of choice they would like to have in the future for their children, or what choice they want to give their future children. If they would like to inform their children and they want their children to be able, or the child or the children to be able to find the donor in the future, be able to contact their genetic parent, whether it's a sperm or egg, then of course they must go for ID release donor. And if the country they live in allows it, then of course that is the kind of donation they get. And it's a complete personal choice. Some intended parents may choose not to have ID release or non-anonymous donors and decide to go for non-ID release or anonymous donation. And if that's the case, then the child, when they reach at the age of 18, will not be able to trace the donor through the clinic or through Cryos. And therefore, it's very important that that is the first choice the patients need to make. The second choice is, okay, what the regulation in their country is and whether they can do that particular donation or not. For example, some countries may allow both kind of donations. In the US, there is no restriction on which one you go for. If they decide to go for a particular donation type, then they need to make a decision which country they want to go to. For example, if they want to obtain eggs from Cryos, and they are in UK, currently the regulations in UK allow ID release, but the compensation rate that EU allows is not in line with what UK allows. And that hasn't come, unfortunately. HFEA needs to hopefully change that process and bring the compensation rate that is allowed for donors within EU to be in line with the EU recommendations of Tissue and Cell Directive as well. So it is very important that they do a bit of research, but that's absolutely fine because they can still obtain the donors that they want, but go to a treatment country of their choice. Now, we in Cryos will be able to advise them. We have what we call reference clinics, which means that we have worked with these clinics, we have assessed their quality, we've assessed their success rate, we have trained them in how to use our eggs best to get the best potential and best results for pregnancy. And we can recommend to them which clinics are reference clinics, and then they can use the eggs that they obtain from us through those clinics. And that is something that is important. And our customer care are very experienced, and they can take their hands and lead them through the process. So they're not going to be left alone to make the choice. They can go on the website, they can see the website, and make the selection of the donor that they want, and then they can have further discussions with. But that's very important, knowing what type of donor they want with the anonymity, and then deciding which country, or whether in their own country. For example, if they're in UK, we can have the whole process done in Ireland, which is around the corner from us. So, and they can have non-ID release donors and travel to Ireland, or travel to Cyprus, or travel to countries that are nearby, for example. From Europe, I think it all depends. Some countries, of course, there's not unanimity of the regulations still within Europe. So some countries allow egg donation, some don't. For example, Germany doesn't allow egg donation, and therefore patients from Germany often travel abroad for their egg donation. So it really depends where they're from, but we can help them when they come through to us.
And what about in the US? Because I know the egg bank through Cryos has been around for 5 years.
We've had the egg bank for 5 years, and the US, we don't have these restrictions at all, so they can choose the donor that they would like to have, and then where near them, where they, for example, have had treatment with a clinic they already know, or a clinic of their choice, and then we work with the clinic. Most of the clinics in US already work with us, so that's good news. But if it happens to be a clinic that is not a reference clinic, we can quickly work with them and go and train them.
That's good. And could you talk a little bit about fresh eggs versus frozen eggs? Because that's a question that comes in.
Sure. That's actually an excellent question, because we get that a lot from our patients. Historically, because egg donation has been around for many, many years. I think the first egg donation treatment was done back in 1983. So it's not a new procedure, and it has been very successful, with hundreds of thousands of children born safely as a result of egg donation process. Historically, it was always done as a fresh cycle, which meant that the patient that needed to have egg donation would go to a clinic. A clinic would then look on their list and see who they have as a potential donor, try and match the two together phenotypically, so look-wise, blood type, and so on. And then try and synchronize these two treatments, so stimulating the donor and preparing the recipient, and then do the egg donation. This process can take a long time. One, whether there is a donor that meets the phenotype features that they want, from the nationality or the background and eye color, hair color, skin color that the patient would like to have, all the way to other tests, and then having to go through all the sexually transmitted diseases, genetic testing, and so on. The process could take many months in order to do. Now, with the last 5-6 years, where a new technique came out, which revolutionized us for us as embryologists to be able to freeze eggs successfully, because we couldn't freeze eggs very successfully in the past. It's called vitrification process, and it's been very successful. We get 98% survival rate of the eggs when we freeze them. And what happens as a result is that we can now freeze eggs and keep the eggs. So we don't have to do this fresh cycle that we used to do previously. And therefore, what happens is we can now bank the eggs. Now, egg freezing is a difficult technique, I must say, even with vitrification. That's why we've developed over the years, over the last 5-6 years, that when we set up the US egg bank, a very special technique in order to be able to successfully freeze it and get very good results. Currently, our pregnancy rate in US is 75% with our egg donation. So in order to develop this program, we have frozen and defrosted or warmed thousands of eggs to get the process very good and to a very good success rate. What happens is, of course, some clinics are still scared because they may actually suggest go for fresh egg donation because it's still back of their mind. They are thinking of the past where the eggs didn't survive well.
Yeah.
But now that process has changed. So banks like us who are experts in freezing can freeze and thaw or warm the eggs very successfully. And luckily, what we are seeing in the last few years, there is a huge trend towards using frozen donor eggs. First of all, they only need about 6 to 8 eggs maximum. So where in the past, if you did first cycle, the patient would end up maybe with 20, 25 eggs. If you are over 40 and you want only one child or maximum 2, you may end up with a lot of surplus embryos, which you then need to face the difficult situation. What do you do with them? Do you put those embryos for donation, or would you then discard the embryos? So really, for a successful cycle, you only need about 6 to 8 eggs. And then you get enough embryos for one embryo transfer. What we are seeing now from, for example, SART and other publications that are coming out, for example, from US that do a lot of using a lot of frozen eggs, we see that in the latest reports they're giving out that the trend is going up towards frozen eggs. And because it's going towards the frozen eggs treatment, the multiple pregnancy rates have come down, which is much better for patients because they're having single embryo transfer rather than thinking, God, I've got so many surplus embryos, I now need to transfer maybe more. So the risk of multiple pregnancy rates and complications of pregnancy have been lowered as well. And therefore, banks like us are moving towards educating more and more patients and making them aware not to worry about using frozen eggs because the success rate is now comparable between the fresh and frozen eggs. Not only that, they will hopefully end up with the number of embryos they need for the number of children that they need, rather than this excessive number of embryos that they will have to face later on, whether they keep or discard. And on top of that, the risk of multiple pregnancies and miscarriages and so on has come down through use of frozen donor eggs. But we have a lot of information on our website, which will explain everything in details. So by all means, if you have viewers that would like to see more, I would suggest that they can see the website.
Absolutely. So I'll put the link to the link in bio to your website so people can check it out. When people get there, how would you suggest people navigating looking for an egg donor? Where do you start? And that's one of the questions that came through in advance of this. And by the way, if you have questions for Sagar now, please feel free to ask. But where do you start with this journey? Because it's such a big thing to even start the process of, isn't it?
Sure. So when they go into the website, on the top right-hand side, they will see the country setting. So if you're logging in from an IP address, which is in UK would automatically come up. And then you see donors that are available, that are UK standard. Because another great thing that we are doing is we're making our donors, and maybe that's why it's such a vigorous procedure, with the screening of our donors. We have to make them UK standard, Ireland standard, EU standard, FDA standard, Netherlands, Finland, and so on. So the eggs that are being frozen and the donors that go through the process, they have actually been checked according to regulations, whether it's documentation, consent forms, a specific screening process we need to do according to all these countries. So they will see their standards under each donor, which a standard the donor has been produced to. So then if they see donors that are in UK, and of course, if they can't have those donors that need to be delivered to UK or say to Netherlands, They can choose, instead of the country they're in, they can change their country setting and go to a country setting of their choice. They may want to have treatment in Cyprus. They may want to have treatment in Ireland, for example. They can change to Ireland and they can see maybe even more donors that are according to Irish standard. And therefore, then they choose according to what the phenotype is, the background, the education, the screening, and so on.
Can I see pictures for ID release?
Yes, for ID release donors, we have childhood photos.
Yep.
And then, of course, if they want to see, some of them have adult photos, but they must go behind a wall. So they must register it, and we don't want to completely open these adult photos for everyone to see immediately. So they need to go through a process and behind a paid wall that they can see this the adult photos. And some of our donors have agreed to have adult photos.
A question, sorry to interrupt you there, but just something that comes up sometimes is readers saying they haven't found the ethnicity that they're looking for. So do you have a range of donors
Yes.
that can help match with intended parents for what they're looking for?
And trust me, we are doing our best at Cryos to make sure we provide as many ethnicities as possible. And yes, that is a challenge, but we have a good, currently we still have, and we are working towards getting more and more ethnicities and backgrounds that would fit the need of our patients. Yes, that's a great question. And they will be able to see, so perhaps some ethnicities we won't have many donors, but we still have enough for them to have some kind of choice for the background they need. One thing before I forget, I mentioned here, so besides anonymous and non-anonymous donation, we also have, for each of these donation, we have an extended profile and then a basic profile, similar to perhaps what you may have seen for the sperm donors. So extended profile, the patient gets a lot more information from the donor. For example, there is an audio from the donor talking about why she has decided or he has decided to make the donation. And there is a handwritten note. There is extensive emotional evaluation that we have done. There is our staff impression from the donor. Of course, there is adult and childhood photos as well. And basic profiles also have a lot of information, but not as much as extended profiles. A whole family tree and a very detailed questionnaire that the donor has filled in about what the donor likes, what are her favorite books, films, what they like to do as their interests, are they artistic, what sort of music they listen to, and much more. And for some of our patients, when we speak to them and say, well, which profile do you actually prefer? The result has always been that we want to have more to talk with our future children about the donor. And if that is the case, and patients out there would like to have a more extensive talk with their children in the future, then we suggest that they go for extended profile, because it gives them a lot more information about the donor to discuss.
Absolutely. Something that we haven't touched on, and for those who are joining, please do tell us where you're at in the process. Have you started looking for an egg donor? Are you thinking about it, etc.? So love to hear from you. But what I wanted to ask you, Saga, was how about siblings? So what's the pregnancy limit? How does that work? And what are the legalities around egg donation?
Okay. Again, another excellent question. One thing before I forget, if you choose a donor that you like, please put it in your favorite basket, because the process of selecting donor probably takes the longest. And you want to be able to go back and find the donor that you've liked. So you can select a few donors, make them your favorite, and then make the final decision. If you choose a donor and you order, especially with eggs, because obviously it's more difficult process to get egg donors and the number of eggs from each donor that we get. If you've chosen a donor and you are expecting to have a pregnancy, or you have a pregnancy, we strongly suggest you also reserve some eggs for the sibling, because you may wish to have from the same donor maybe 1 or 2 more children. So please make sure, because obviously if we have completely finished with the number of eggs that we have in a storage for that donor, there is no guarantee we can have the same donor back to donate again. So that's very, very important to bear in mind. And the reservation can be done through our customer care, and then they get a refund if they decide not to use in the future. Going back to the question that you asked with regards to, I think it was,
It was legalities.
Legality.
And, a cap
Number.
on how many pregnancies.
Yes, it depends which country they are in. So, for example, in UK, the family limit is 10. Right. So, from the same donor, they can have up to 10. We can have up to 10 families, and that's not including the siblings. So, siblings are different; they're not counted as a family. They all count as the same family.
But isn't the chance of having more families or more children using the same donor slimmer with egg donation, sperm donation, for example, because there's a limit to how many eggs there's going to be?
Sure. So it is a slimmer for egg donors because we don't have a huge number of eggs. So the chances of us getting to a family limit of 10 in UK, for example, is very, very slim. But one thing that I must say here to reassure the patients is that these family limits have been set according to the population of the country. Okay, so for example, UK, because of the size of its population, to reduce the risk of the half brothers and sisters of a meeting or ending up together in the future, is 10 families. Now, for example, somewhere in Cyprus, where there's only 1 million population, one donor can only help to produce 1 family. In Spain, for example, is 6. In Ireland, is 3. So this depends on it's not something we set. This is done by the regulatory bodies in the country that the egg donation takes place.
And USA more because it's a large country.
Exactly. For us in Cryos, we have a very strong infrastructure that can hold all this information with regards to knowing where we have sent the donor, because we ship donor eggs and sperm to over 100 countries worldwide.
Wow.
So we have this infrastructure that we know exactly where we have sent the eggs or sperm. We know the family limit in each country, and before we even get close to the limit, we may completely stop the use of that donor until we get the information back from our clinics and our patients, whether there has been a pregnancy or not. And therefore, then we can re-release the donor if there's not been a pregnancy or we feel it's not close enough to get to the family limit they need. So patients can rest assured that we have this very strong, IT system that can organize all these processes for us. But they also can buy the pregnancy quotas, which is which can be explained to them, which is to make sure that they can use the same donor in the future, and also the fact that they are not going to get to the family limit.
Yeah.
So
that's really useful information. I've learned so much today. Thank you so much for this. For anyone who's joined or listening, you're thinking about egg donation, please do head to the link in our bio to check out Cryos International's website, learn more, have a look at the donors. Very exciting that you have opened up the egg bank in the EU. It's, as you said, been a long time coming. As you mentioned, with COVID and all the limitations on people finding egg donors, it's a wonderful thing to be able to give people more opportunity.
Definitely. And by all means, as I said before, I think it's very important that the patients or the clinics that are coming to the website know that there is a good support from the customer care. They can help them through the process. They don't need to feel lonely or lost when they're looking through for the right donor. We will be here to help them. And we hope that we make the dreams of many families to come true, because at the end of the day, that is the purpose and that's the vision of Cryos.
Absolutely. Thank you so much for your time today, and thank you everyone for joining. It was very, very insightful.
Thank you very much for your invitation.
Bye-bye, everyone. Bye-bye.
Bye. Keep safe.
Bye-bye.